All right. All right. We've also heard that children and youth in care experience disparities in outcomes, such as in the areas of education and employment. So in response to these challenges and issues, the Ontario government released its plan to redesign the child welfare system in July 2020. It is based on a collaboration and consultation with a large range of stakeholders that include 100 engagement sessions and over 3,000 survey responses. The multi-year strategy committees in partnership with cross-sector providers to enhance community-based prevention and early intervention. It will address systemic racism and the disproportionalities and outcome disparities for Indigenous, Black, LGBTQ, and other equity-deserving populations in child welfare. And it will continue to improve the service experience and outcomes for children and youth that do need protection services, including more family-based options. The vision is to transform child, youth, and family services so that in Ontario, every child and youth has the supports that they need to succeed and thrive. To do this, all sectors, organizations, and individuals that impact the well-being of children, youth, and their families need to be included in the transfer. Redesign imagines a future state where all human services and communities work together with families to build on their strengths, enhance resilience, where government, ministries, and cross-sector partners have a shared responsibility and accountability for improving child, youth, and family well-being across the life course and eliminating outcome disparities for equity-deserving groups. Where Indigenous children and youth are healthy, happy, resilient, and grounded in their cultures and languages and thriving as individuals and as members of their community. Where the design and delivery of human services available in every community is driven by local perspectives, and where in the long term there will be well-being, such as by the reduction in the number of referrals to children's aid societies, an increase in affordable housing, and the reduction in the disparity of outcomes for racialized children and youth who are in CAS care, just to name a few. This slide depicts the future state with children, youth, and families at the center of the various sectors that people interact with over the course of their life. It is not an exhaustive list, rather it is a conceptual work in progress. It depicts the need for a whole-of-government cross-sectorial approach. The life course approach recognizes the complexity of identity and how an integrated cross-sectorial understanding of client experiences can inform the delivery of the right service. Strategy aligns with and will leverage other transformational government initiatives such as the poverty reduction strategy and the mental health and addiction strategy. Separate to child welfare redesign, the Ontario government partnered with a range of First Nation, Inuit, and Métis representatives to develop the Ontario Indigenous Children and Youth Strategy. This strategy is a whole-of-government approach supporting all programs, policies, and services impacting First Nation, Inuit, and Métis children, youth, families, and communities. It seeks to fundamentally transform the system for Indigenous children, youth, and families. It is rooted in a holistic, preventative, and culture-based programs that are designed by and for Indigenous peoples. This is a redesign, and as such has reaffirmed the government commitment to advancing the OICYS. Guided by this strategy, the ministry will ensure that First Nation, Inuit, Métis, and urban Indigenous partners continue to be engaged meaningfully, and that all parts of the child welfare redesign strategy are co-developed and informed by these perspectives. As you may be aware, child welfare has been moving towards this goal, with the number of Indigenous child welfare agencies increasing, as well as the use of formal customary care agreements as a viable option for Indigenous children and youth. This slide outlines the 6 components that will contribute to the achievement of the long-term vision of this multi-year effort. The first component is projects to achieve strategic pillars. 5 pillars have been identified that support a number of priorities and initiatives. These are aimed at helping the child welfare system to improve outcomes for those involved with child welfare and residential services. A second component is community-led implementation and design. The ministry is committed to co-design and co-development that prioritizes the voices of children, youth, and their families. Feedback from all engagements and community conversations, such as the ones we're having today, will be used to inform policy and decision-making. A third component is the use of data, evidence, and advice. We want to hear from families about what supports are improving their outcomes and leverage their voices as part of the working with community partners to identify where resources and funding could be redirected and shifted from protection-oriented budgets to prevention-focused initiatives. The ministry will reinvest in areas that leverage cross-sector solutions to address complex challenges. A fourth component is the use of robust measurement of outcomes. The performance measurement framework is currently in development. This will help identify the outcomes we want for children and youth that need protection services and well-being outcomes for children, youth, and their families more broadly. Community initiatives. The ministry is looking to communities, children, youth, and families, as well as cross-sector providers for transformational ideas on how services may be improved in their community. We want to empower communities to participate in the design solutions for your community and to support you to test and evaluate these solutions. And the final component is alignment across government. We cannot achieve the future state without close collaboration with other human-serving ministries. The ministry has identified several areas such as health, education, and housing and well-being that all have shared objectives. As described in the previous slide, projects have been identified under 5 strategic pillars. Each of these align with one of the 5 key priorities. These include child, youth, family, and community well-being, quality of care, strengthening youth supports, improving stability and permanence, and system accountability and sustainability. These projects are to focus on improvements to the child protection system to transition and align assistance with the holistic and integrated child and family services vision. What we hear through engagements and community conversations and what we learn through community-led prototypes will be the foundation of the child, youth, and family well-being framework. Ministries and cross-sector partners. It is expected to be the blueprints for transforming the Ontario Child and Youth Family Services system from being reactive to proactive and prevention-focused, implementing the OICYS as part of an integrated human service system. It will articulate the guiding priorities and common outcomes and definitions of child, youth, and family well-being across sectors so that all sectors agree on a commitment to aligning efforts toward measured improvements in child, youth, and family well-being. It will highlight the best practices and promising initiatives to support communities in the co-design, development, and delivery of local solutions. The framework will use a life course approach to services that contribute to increasing protective factors and applying strength-based, trauma-informed, and culturally relevant approach to designing and delivering policies, programs, and services. The changes will be data-driven, and there is a commitment to robust evaluation of the prototypes that can be scaled up to take us from the current state to the future state. To do this will require collaboration and co-design. This is not a scripted vision, rather it is a comprehensive strategy to work with communities, children, youth, and their families, Indigenous and other partners to co-design and collaborate. It may look different in each community with the different steps. We will identify existing groups and build new ones as required. There is also a youth engagement approach to ensure youth are engaged through a variety of mechanisms. Now I'm going to turn it over to Sonia Dennis from FACTS Waterloo, who's going to share with us some of the steps that they've been taking towards reaching this goal.
Great. Thanks, Harriet. Thanks, everyone, for having us. And definitely, I'm just going to give a very more quick overview, but definitely if any further information or you'd like more, we'd be, myself or my colleagues would be glad to come back and have further discussion with the group. So as Harriet spoke about in regards to the overrepresentation of Black, Indigenous, 2S LGBTQ youth, as well as other racialized members of our community, we started to really take a look at our data in 2016 when the Human Rights Commission asked us to start collecting the data. And as we've collected that data, we know clearly that this is not a Toronto issue or a big urban city issue, we have overrepresentation, stark overrepresentation in these areas within Waterloo region, within our system. And so we have done and continue to really look at ourselves internally, understand the harms that we have done as a child welfare system, and in many ways continue to do as a child welfare system, continue to understand racism, how that plays out in our work. And we've developed a new strategic plan, and at the core of that strategic plan is equity, anti-racist practice. And, with our, one of our pillars is to work with community partners, families, to reduce the overrepresentation of Indigenous, Black, racialized, and LGBTQ2SQ children and families. And we also know that we have a growing overrepresentation of Latinx families in our community, in our child welfare sphere as well. So one thing for us is really to really move our practice differently, and to work with community and families to do that. In 2018, we emerged on developing a service delivery team, and it's actually, I'm going to say a unit now because it's quite large, called the Two Row of Understanding Services team. And some of you may have heard of them or not. That team is focused on delivering service to First Nations, Inuit, and Métis children, families, and youth in our community. It is led by Indigenous service director, and we have a number of Indigenous staff, and we are working and developing a service delivery model. But that was very, very clear that we needed to have a department to be able to work with, their own community here in Waterloo region, and to address the stark overrepresentation that I spoke about. So that has been moving on since 2018. And then just last year, it's just just over a year old, we developed what is now called the Harambe team. And that is a team of mainly Black and racialized staff, who their work now is to work with Black and racialized families within Waterloo region, and families also who new immigrants as well to our community. Because again, through the overrepresentation, we're saying we need a different model of service for these families. So that team is about just over a year old now, and also developing a unique Afrocentric service model in our community. So for us to, really looking at the overrepresentation, and we have also work happening in regards to 2S LGBTQ families and youth, and how do we make connections with community organizations in all realms to move this work forward. So we are definitely working towards, in line with Redesign, how do we serve children, youth, and families differently? How do we serve them within their community context? And how do we serve them and work with you as community partners in lowering the overrepresentation? We know we can't do this work ourselves. It's not our work to do alone. This really is a family and community work that needs to happen. Also, many of you would know we have a resilience project within our organization that is partnered with 17 different organizations. And one we've just launched with our partner organizations, service system navigator positions. So those are, held within the community organizations. There's 4, and those workers will work with families to navigate large systems like child welfare. How do they navigate, and but also other large systems in the community? And that is through the Resilience Project, and it's being led by community, and those positions are housed within community organizations such as Afro, Adventure for Change, Kinbridge, and Healing of the 7 Generations. So, there's a lot of work for us to do by many, many means. We have continue to do work, but we wanted to, Harriet's been wonderful in, being able to have us join these meetings so that you hear the provincial context of child welfare redesign, but then you're able to hear a little bit about what's happening in the local sphere as well. And then obviously there's lots more that I could say locally, and would be glad if to come back and have those deeper conversations. But we just wanted to provide you a bit of the macro piece and then the micro piece of the work. So I'll leave it there because I know Harriet has some questions and discussion she'd like to have with this group.
Thank you, Sonia. So that concludes the more formal part of the presentation. As I've been going out into the community, I've been presenting at tables, and then they've been helping me find grassroots organizations and individuals to talk to from various communities, which has just been a really wonderful experience and learning all kinds of neat things that are going on in your community. But I'm sure that there's still lots for me to learn. So when I go into these meetings, I ask 3 questions. Generally, they are, what are the services in your communities that help children, youth, and their families achieve well-being? What are some of the barriers to them achieving that? And then how could services be delivered differently so that children, youth, and families are able to achieve their well-being? And as well, I'm always looking for new referrals of other people to have conversations with. So I'm hoping that perhaps some of the organizations that you work with might be interested in continuing to have that dialogue with me. I would very much appreciate doing so if people can share that information with me. So we only have a very few minutes left. So I know we're not going to have a great conversation, but perhaps if anybody has some immediate feedback or questions that they would like to share at this time.
I think I'll just maybe start with a very, I don't know whether simple. I know it's a very good strategy trying to collect data and analyze. I don't know the depth of the data that was analyzed, whether culture was taken into consideration, because culture is a very huge component when it comes into a system trying to support a family. Because we all come from different places, and we all have been brought up with different way of living and different way of responding to situation. My background is Ghana. If a parent's child is in trouble, they take that parent's child and give to an aunt or a cousin, someone who is still close. So the child is still somehow within the same family until the parent comes back and he can pick it up. Here, I don't see how, I haven't been into the child and welfare system to understand how they place children. Otherwise, the system will be such that you would definitely be getting racialized people dominating, because their culture is totally different from the culture on which the system was created. So in order to be able to support the racialized people, I think we need to go back to the roots and start with the culture and bring it up to build a new system, rather than taking the existing system and going back to them to see how that they will fit into the existing system. And that is what, so I don't know the detail of the data, but I think we definitely need to take into consideration some of these cultures of our groups.
Yeah, and certainly the data does support exactly what you're saying. So I think this strategy, I'm feeling optimistic about it, because I think it, rather than the government saying, okay, here's the problem, this is how we're going to fix it, this time around we're actually going out to the people and saying, okay, you define the problem and then you tell us what the solutions are. And then based on that, you know, we'll sort of collect some data and say, yes, the strategy works, or that one didn't. And then those prototypes that we're looking at communities trying out, if they prove to be successful, then, you know, we can scale them up rather than recreating. And certainly I know, you know, such as the Resilience Project in Waterloo, that's a wonderful way of working. So, you know, we've taken that data and we've presented it to the policymakers. And so I'm looking for any of those kinds of projects that people are already doing. There may be some money to, if people have some creative ideas, there may be some money to sort of try it out on a small scale and collect some data and see if some of the creative ideas that you may have had actually work, and we can use them in other communities. So I think it's really kind of a neat opportunity, certainly in my experience working with the government. It will take a number of years, so part of the work will be to keep the momentum going, but I know that in your community it's already underway, so I'm very optimistic for your community. Is there any other comments that anybody wants to make at this point? Tracy?
Yeah, I was just gonna, you sort of made note of it from a timeline perspective. And in the meantime, I suppose, what risks are present sort of until a better mousetrap is built. so, and you may have reflected on it already, but just even sort of hearing it again, what do you perceive to be the timeline process? And yeah,
they're calling it a multi-year strategy. I think these things always tend to take a bit longer than, particularly if we're going cross sectors and all the work that entails. So I'm not going to say 5 years, 10 years, 1 year, 2 year. I really don't know. But certainly I can say there is an appetite for this that I haven't experienced before. So I appreciate people getting involved. I think I saw some. Tara, I see your hand up. I think there was also somebody else.
Perry had her hand up first, but she's turned off her camera.
Okay.
Okay, so I'll just go then. I had two thoughts. One is so this is our leadership council for the Immigration Partnership, but we convene a number of steering groups that bring together whole other groups of partners in the community, and it might be good for you also to connect into those groups with this presentation and discussion if that's possible. And then I wanted to ask about the correlation between employment and income poverty and the reasons that families may be coming into contact with the child welfare system. When I lived and worked in Hungary, I did a bunch of work on child protection issues, and many of the families that were coming into the system and from groups that were disproportionately represented came into contact with those systems because of poverty. And so I'm wondering, how much of, from a prevention focus, there's a big case for, alignment with economic development and workforce strategies for the groups that are impacted in our region. I don't know what that data looks like here, but that was very clearly happening when I was in Europe working on these issues. And, there's a lot of stuff going on with workforce development here. So how does this then align with work in that area is, I guess, a question.
Yeah, no, great question. So as I had indicated, it is a multi-sectorial approach. So certainly we're going to need folks from education involved. We're going to need folks from employment services involved. We're going to need people that are dealing with social services. I did child welfare for 25 years before I joined the ministry, and certainly poverty was such a huge factor that I think if we could solve that problem, I put in my caseload anyway. So I certainly agree with you. And so the hope is, let's take some of the money that we're pouring into keeping kids in care and working with families at that level. Can we shift it to some of the smaller community-based equity deserving groups that are actually doing the work and do some of the prevention stuff so that we won't need to have as many resources in the child welfare sector. So it will involve, because, child welfare can't solve poverty. There's a lot of the problems that they can't solve. And that's why we really need it to be a multi-sectorial approach.
Terrific. I know Perry had a comment, but I think we're pretty close to the line. Perry, is it a brief comment?
It's one brief comment. Sorry, I had to run someone else at the door. I appreciate the presentation. As you mentioned, child poverty, there are many aspects to that. I don't think it is about access to, it's about systems. It's about access to our existing systems. What can we do to improve those access? And my question, how can each one of us around this table do our part in making sure this project will reach to the grassroots communities and racial expectation, and how can we do our part, basically? What is it that we can do and how?
So at this point, if you can help me connect with as many people as I can, I'm willing to do that. I really want to hear from the grassroots organizations because we don't tend to hear from them as much as we do, some of the larger organizations. So any referrals that you can make to me of people, if there's individuals that you work with in communities, I would really like to speak with those folks. If within your agencies, if you have some teams that are doing the work on the ground and they have some advice, would love to hear it. At this stage, it's really just sort of collecting as much information as what's happening in communities and what people's thoughts and advice are, and then shifting into more of a co-design space. But I very much feel that your community is already there, so I'm not too worried about that piece, but just really want to understand what's happening in Waterloo, and the only way I can do that is by talking to the folks that live there. So at this point, that would be the most helpful thing that you could do for me. And perhaps if what I'll do is I will share the deck with Tara and my contact information, and then if people have some suggestions, you can reach out to me, or if you want to talk a little bit further or whatever, happy to continue the conversation.
Terrific. Thank you both to Harriet and Sonia for joining us today. Much appreciated. We are just a couple minutes over. We've lost a few folks, so I will adjourn and just remind us that our next meeting is on April 21st. So we'll look forward to producing a package to pre-send for you before that date. And thank you for those who have volunteered. We have our next territorial acknowledgements looked after for the next few meetings as well. So thanks again. And if there's anyone else interested, just reach out to me and let me know that as well. We'll make sure that you have the opportunity to do so. Thanks for your attention today. Thanks to our special guests. And again, thanks to our new members and our existing members as well. Enjoy the rest of the week, folks.
Thank you.